Hey guys, welcome back. My name is Vinod, and my blog is called Med School Easy. And I'm here today to talk a little bit about what you can do to help yourself get into med school with a gap year or a year off. Um, Increasingly, we find that a lot of medical students who are getting in are taking 1 or more years off, whether it's because they're working or doing research, or it's sort of not very clear sometimes, just because there's so many different things that people are doing, a lot of cool things that people are doing. So I want to kind of demystify that today. And for those of you who are looking to use the year off to improve your application in some capacity, this is the video for you. If you're senior applying to med school, or you're a college senior, or you're out of college and you're looking to apply to med school, this is the video for you. So um, I guess there are three fundamental types of students looking to take a year off, and so I'll go through each of these three. Number one is a student who um, has not done well in terms of their GPA or in terms of their MCAT, and who needs to take a year off just to strengthen their application from that perspective. The second type of student is a student who does have good grades and test scores, but is still, like, either has been rejected or is not getting good feedback from med schools. I know a lot of people who personally who have done well on their tests, or decently well or fairly well, but who are just not getting interviews, or not getting any recognition from medical school. So that's the second type of student. Third type of student is someone who does have the grades and GPA and who's looking to take a year off to enhance their application. They probably could get into med school, but they're just looking to enhance their application or enhance their life experience in a different way. So I'm going to talk about these three types of students today. So number one, the student who has a deficiency in GPA or MCAT. Now, the reason that I make this its own category is because the GPA and MCAT is really, unfortunately, what medical schools focus on for admission. It's probably, you know, I don't want to put a percentage on it, but I would say definitely well over 50% of the equation for applying. And so it's really important to have good GPA and good MCAT. Now, if you are in your junior year, if you want to go straight to med school, from college, you have to apply in the end of your junior year, in the summer of your junior year, to get admission for the fall after college. So if you are kind of at the end of your junior year or in your senior year, and you are not planning to apply because your GPA and MCAT is low, you have to look at taking a year off. And so what do you do with the year off? I think most colleges, if you're looking at the GPA, most colleges have post-baccalaureate programs where you can stay an extra year or stay an extra 2 years and essentially just take extra classes and boost up your GPA. And the reason it takes a year or two is because you've already taken 4 years of classes. So to really make a dent in the GPA, you do have to take an increasing number of classes as you progress throughout college. As an example, if you had taken one semester of college, it's a lot easier to correct your overall GPA by the next 3.5 years of college. But if you have gone through 3 years of college, now you have 3 years worth of coursework that needs to be offset. So that is the rationale behind post-baccalaureate programs. I also know that there are a few master's programs that could help you, and specifically, there's a program called the Masters in Physiology, which has sort of become a new thing. I knew nothing about this when I was applying to med school, but now in med school, I know a ton of people who do this. Basically, the most famous one is through, at least in my school, is through Georgetown University, and I'll include a link below. But the Masters in Physiology is basically you taking the first year's worth of med school classes. Obviously, you're not in med school, but you're taking first year med school classes. And the idea is, if you do well, you can show med schools that, hey, I can handle the med school coursework. That's the entire point of this. And certain schools certain schools who offer the Masters in Physiology program have medical schools such as Georgetown. And I don't know about Georgetown specifically, but I know some of them do give you preference for admission to their med school. So it's sort of the school's way of giving you an incentive to do this program. So talked about post-baccalaureate programs and master's in physiology programs to boost your GPA. To boost your MCAT, obviously taking a year off is tremendous because you could, be working in a 9 to 5 job, or even not be working at all, and you could be studying for the MCAT and planning to take that and really improve on your previous performance. Again, if your GPA isn't that good, doing very well in your MCAT could be the thing that gets you into med school. So for those of you who don't have a good GPA or MCAT, there is still hope if you do tremendously well in the MCAT by really taking time off and studying wholeheartedly and not having the distraction classes. That could boost your MCAT score pretty high and really get you in. So I talked about the student who has poor scores and how they can approach their studies. So now I want to shift focus to the student who does have good grades and test scores, but who's just not getting in, or is just getting negative feedback, or who didn't get any interviews. I know quite a few people who have had this problem, and I'm not really sure. They don't even know why they were not getting into med schools. Some of them were really qualified to get into U.S. med schools, but then went to Caribbean or went to DO just because they weren't getting in. So I guess this section is more of a general advice for things you could do to boost up your application. So I think there are a few different things you could do. I would say, for example, I would say the first thing you could look into is a potential scholarship opportunity. What I mean by that is, there are certain programs like Fulbright Scholarship, Truman Scholarship, Peace Corps. There are all these different things, depending on your passion, obviously. I mean, if you love teaching, there's something called Teach for America, which all of these things really help you grow as a person. I think that's the biggest reason that med schools look favorably on them. They really help you develop as a person, and they also really will make you a better doctor in the future and will help you get into medical school just sort of by doing them itself. So these are basically programs that I'm recommending for people who have the grades and MCAT score and are just not getting any recognition. So those scholarship programs are one. The other thing I would recommend for these types of students is doing research, and it's sort of like a little intimidating to talk about research because I feel like it's not very well advertised. If I were to just go up to a pre-med student and they asked me about research, and I told them, okay, so how are you getting involved in research? A lot of them might just draw a blank because it's not very clear how you get into a research opportunity for the year as a full-time position. So I would say that the avenues you could approach this are, if you are at a big research institution, if your school is a pretty big school, you could just email faculty. So that's the obvious way, just cold emailing. That's what I did. Or there are other avenues that you could pursue this. There are forums and websites where research technicians will post for job opportunities, and this is something I knew nothing about when I was a pre-med, but a lot of people who I went to college with actually did this, and I'll post some of the links down below. But for example, I know one of the websites for orthopedics research is called orthogate.org, and orthogate.org is essentially a forum where research technicians who are working with attending orthopedic surgeons will post for research opportunities, paid research opportunities for the year, designed for pre-meds or med students looking to take a year off. So those are fantastic opportunities to take advantage of. Again, a scholarship, Peace Corps, TFA, research, these are all things that for the person who really does have the test scores can help them. And finally, there are just students who want to take the year off, and it's not really because of an academic reason. And I can relate to this because I really feel that pre-med is a pretty tough grind, and medical school is even tougher. So if you're burnt out after pre-med, it's really important to take some time off and to do something that you really love. And a lot of schools, you can either choose to apply late or you can choose to defer your admission. Deferring admission varies on the school, but usually if you write a letter and if you have a recommendation from someone in the field that you're looking to work with, they'll generally grant you a year off. So again, the year off for this third type of student is not to just sit around and sit on your couch for a year. It's more for you to do something, maybe like 9 to 5, or do something like that involves travel, teaching in a foreign country, teaching English in like a foreign country or something that basically really allows you to explore outside of what you've had to do in college. So again, the 3 types of students I've talked about in this video are those who have low scores, those who are lacking maybe in extracurriculars in some capacity, and those who just purely need a break or want a break from the pre-med med school curriculum. So I hope this video helps you guys out on your journey to becoming a doctor. As always, please subscribe or let me know how these videos can help you guys out more, and send me an email if you have any questions. Take care, guys, and best of luck with your studies.